In this video, we shall learn about the IAP Advisory Committee on Immunization Practices in India, Immunization Update of the year 2018-2019. This is a very important topic and especially very useful for the exam going students, both PG entrance examination as well as MBBS and MD final examinations. So the first recommendation is that the birth dose of hepatitis B vaccine is a must, preferably within the first 24 hours of life. This is because the decision to delay the dose of hepatitis B vaccine can be made with precision only and only when the mother's HbsAg status is known at the time of infant's birth. Next, in case pentavalent or hexavalent vaccine is used, 4 doses of hepatitis B vaccine are acceptable. This is required for the feasibility of the institution of the National Immunization Schedule, since a child already comes for receiving other vaccines at the ages of 6, 10, and 14 weeks respectively. The third recommendation, either DT whole cell pertussis or DT acellular pertussis, either of the two can be used for vaccination in the primary series. This is because both acellular pertussis and whole cell pertussis have equal effectiveness in preventing the disease in the first year of life, even though rapid waning of immunity has been seen with acellular pertussis, while whole cell pertussis may be more reactogenic. Next, IPV should replace OPV completely and as early as possible in the 3-dose schedule at 6, 10, and 14 weeks. This is aimed at preventing the cases of VDPV, that is, vaccine-derived polio virus infection, which may arise with the administration of OPV and which was specially more commonly seen in the trivalent OPV which was used previously. Next, if IPV is not available, for example in private setups due to limited IPV production, 3 doses of bivalent OPV should definitely be given, but in such cases at least 2 doses of fractional IPV at 6 and 14 weeks or a single dose of intramuscular IPV should definitely be administered at a government facility. Next, monovalent rotavirus vaccine, that is RV1, has to be given in a 2-dose schedule, that is at 6 weeks and at 10 weeks. All other valent rotavirus vaccines, that is RV5, RV11-6E, or RV product unknown, should be given in a 3-dose schedule, that is 6, 10, and 14 weeks. Seventh, inactivated influenza vaccine, either trivalent or quadrivalent, is recommended to all children now between 6 months to 5 years of age annually. This is in view of high morbidity and mortality in high-risk groups including children less than 5 years of age, paucity of facilities for lab diagnosis of influenza, high transmission rates, and substantial socio-economic burden. Eighth, an additional dose of MR vaccine may be administered during the MR campaign between 9 months to 15 years of age irrespective of the previous vaccination status. This is done to support and strengthen the national immunization program. However, MMR should be preferred to MR at 9 months and between 4 to 6 years of age, wherever available, to cover mumps as well. Ninth point, a single dose of typhoid conjugate vaccine, that is TCV, is now recommended from the age of 6 months and beyond, even for child who has received typhoid polysaccharide vaccine, who should be given at least 3 years later. It can also be administered at 9 months of age along with MMR vaccine, but a routine TCV booster at 2 years is not recommended now. The 10th recommendation, IAP endorses the 4-dose post-exposure prophylaxis of anti-rabies vaccine as recommended by the World Health Organization as well, which includes administration of a one-site IM vaccine at 0th day, that is the day when the dog has bitten, 3rd day, 7th day, and between the 14th to 28th day. And now the last recommendation, monoclonal rabies antibody can be administered instead of rabies immunoglobulin for post-exposure prophylaxis. Its advantages are large-scale availability with standardized quality, greater effectiveness than rabies immunoglobulin, elimination of infected animals in the production process, and reduction in risk of adverse events. Thank you so much for a patient listening. Thank you.